a little partial to the next speaker. She's the glue, our expert, our guide, our mentor, and a big part of Children for Tomorrow. And she will tell you a little bit about her part with the organization. Jayna Haney is the clinical director of Children for Tomorrow's CFAT program and the founder of Bridges Across. Jayna's coaching, workshops, and programs have made profound and lasting impacts for thousands of step families and single parents. She has extensive training in areas of trauma and attachment, marriage, parenting, and parental alienation issues. She spent thousands of hours working with high conflict families. She's, in a word, the bomb. So let's hear from Jayna.
So nice to see you all. I really appreciate the information there. I am delighted to be back and appreciate everyone being here this afternoon. I'm sorry you have to hear me twice, but right now I'm going to be talking about the Complex Family Assessment and Treatment Program. We get a lot of questions about it, and I thought I would just give you kind of a brief review, and then I'm going to talk a little bit about some ideas that parents, mental health professionals can use regarding children and responses and things regarding some kind of common things that happen. And then I'm going to try to give some time at the end for questions if I can. And if not, I'll be here at 5 to answer those questions. So I'm going to go ahead and try to share my screen. I had started to, and then naturally. Okay, so here we go. And let me go ahead and press this. There we go. All right, and we are off. So I want to tell you today about a story. Stephen Covey, who wrote 7 Habits of Highly Effective People, 7 Habits of Highly Effective Families, very, very popular man, husband, speaker, a business owner in the 70s, 80s, 90s, 2000s. And he tells a story one day when he was living in New York, and he was in a subway on a Sunday morning. And he says, Sunday morning subway time, this is in the 90s, very calm, very quiet. People are reading their newspaper, talking quietly. And he said this man and these 2 children came running in to the subway car, and the man just kind of sat down, but the children were running up and down the subway train. And he says this went on for 5 or 10 minutes, and they actually went over to somebody and was like grabbing a newspaper, and they were just loud. So Stephen Covey, always a gentleman, says that I leaned over to the man and I said, "Excuse me, sir, do you think that you could please take care of your children? They are disturbing the people on the train, and I would really appreciate if you could help us out." He said the man looked at him and replied, "Oh my goodness, I guess you're right. I am so sorry." He said, "The children and I have just returned from the hospital where their mother died. And I don't think they know what to do. And I know that I don't know what to do." In that moment, Stephen Covey talks about a paradigm shift. The fact that the way he saw the situation, the way he understood it, and the way that he saw it changed completely in that moment. And I love this story in part because I think it shows how quickly we can make changes when we understand the underlying issues or the background or the context of many of the families that we see and that you may see as a judge or an attorney or a mental health professional or a parent. And so I'm going to be talking more today about our complex family assessment and treatment program, because this is what we try to do. We try to see the context and all the other things that are going on. Children for Tomorrow's mission has always been for children to grow up and thrive as mentally and emotionally healthy adults. And one of the ways in which they feel very strongly is they want to develop a community awareness of emotional abuse. When Dwylene Lindsay and Renee Windsor back in 2009 began the mission of Children for Tomorrow, they had a commitment. And they started out working very diligently with the judicial system, with the court system, developing their LEAP program for families, then for educators and for the court system. And then back in 2016 or 17, Dwylene and Renee and I met, and we started talking about this is their vision, Children for Tomorrow's vision. And I am just happy enough to be tagging along here. We did our first assessment in 2018, and here we are 6 years later. So I would like to kind of go over very briefly with you kind of what we're doing and how we work so that you will understand. C4T administrates and oversees the assessment. We have trained mental health, and we align with the amicus. Amicus are not always a part of our case, but when they are, it is always a good thing because we work with them. When an amicus and a mental health professional team are working together, that is really a very strong message to a judge. We are either agreed to by parties, sometimes in mediation, sometimes not, and or court ordered. Our assessment is 6 to 8 sessions. Our treatment report provides comprehensive recommendations, and if desired, we can also oversee the treatment and the providers, generally for 6 months is how we would normally start out. Our program serves the child's best interest because we assist courts, judges, amicus, attorneys, CPS, therapists in making better decisions about the overall family dynamics in a way that an individual therapist or amicus ad litem alone cannot, because there's more of us and because we are all working together. And when there is an amicus or ad litem, then we end up supporting them in terms of working with them to help understand the dynamics. We are able to help keep the child out of the middle of the conflict quicker, sooner, and faster. We treat the family as a whole, but we treat each individual in the family. No one is left out of this process, not one parent and not the other. And we are uniquely designed to heal and restore the family. We know that unseen child abuse and the family court struggle because of, one, the way the family relationships are presented to court, which are actually very highly counterintuitive. We know that very few mental health professionals have the training. We've already talked about this. The court may work very hard to remain neutral. I do believe courts have the right belief, but the processes create problems which often delay. There are often lots of accusations back and forth in the families that we see. The process drags on due to court timing, and then the high conflict label is misleading and inaccurate. I know in the Harris County courts, they actually have a tag that says high conflict. And this is anytime they have a case that keeps coming back over and over again. Dr. Stephen Miller, who sadly passed just a few years ago, was a Harvard medical doctor, did a lot of work in this area. And he talks about this high conflict model does not help because, one, it believes that both parents are responsible. While this is sometimes true, it is not usually the case or always the case by any means. Oftentimes you have one person that really wants to get along, wants to co-parent, and it does not consider that possibility that one party is their aggressor and the other party is in defense mode. We know there's a lot of severe cognitive errors, and then so the use of the high conflict model really doesn't work, but unfortunately the ones that courts have often adopted. Mental health professionals do not have the training needed. Now, I did not go back to graduate school until almost 10 years ago. I was 48 years old, 12 years ago, 48 years old. And I can tell you that even then, graduate school is still trained in the nuclear family. Therapists at all levels are not trained to the nuances, the manipulation, the pathology that surrounds high conflict enmeshment, cross-generational coalition, or attachment trauma. Traditional family therapy, we know, does not work in cases where children are being abused by one parent to reject the other. Children and teens need to be taught critical thinking skills, solution-focused strategies, and coping skills. So most of the time, therapists are taught in all levels, from psychiatrists down to any other therapy provided. They're taught to validate and empathize. The problem with validating and empathizing in cases where there's alienation is this is oftentimes reinforcing the alienation. And the therapist has to pay special attention to avoid taking sides. So regardless if I was doing this work, when I do divorce work, it is my job to remain neutral. It is not helpful to these children if I choose. They already have other people in their life that have lined up behind one parent or another. They need people in their lives, of which our treatment team is one, that remains neutral. Our goal is that both parents have the relationship. Now, Dr. Stephen Miller, who I finally referred to just a minute ago, has a wonderful YouTube video. And if you have not seen it, please look it up. I'm sure it's still out there. I'm happy to give the link in my documents if someone would like to get that and can't. But he does He testifies, I believe, before Congress. And he says this field is highly counterintuitive to anyone who doesn't have extensive training and experience dealing with it. He says most people will usually get it wrong. And he says even well-intentioned people who want to do the right thing are way in over their head. He says we make something called a fundamental attribution error. We are hardwired to make it. It is hard to override it. It's a mistake that almost everyone will make. And it's basically that we judge someone in a situation and assume that is the way they always are. He said, for instance, when one sees a severe case of alienation, the alienating parent is often cool, calm, and collected. They've learned to mimic normal behavior. Oh, yes, I want the children to have a relationship. But by contrast, the targeted parent often has PTSD, has not seen the child in God knows how long, maybe years, and has been told he's the one who's the problem, or she's the one who's the problem, and comes in all intense, all angry, and stressed out. He says, if you go by what you see, a fundamental attribution error will cause the targeted parent to appear as the problem parent. So he says, in summary, someone can be the most well-intentioned or experienced amicus, family law attorney, judge, or therapist, and we say this respectfully, but unless they are trained in the specific dynamics and pathology of alienation or pathogenic parenting or unjustified restrictive gatekeeping, whatever you want to call this, they will get it often exactly backwards. So I want to talk for a minute about our treatment team approach and how we work together. So our treatment team approach is based upon the fact that we cannot make appropriate diagnostic and assessments if we are operating on instinct. We can't just say, oh, we're going to use our gut instinct, because that is one of those instinctive things that is not accurate in alienation. So we can't base our outcomes on that. We also do not, we are also not representative of one person's viewpoint. What happens in our treatment team is not my viewpoint or Wylene's viewpoint or Renee's viewpoint or Shelley's viewpoint or any of the other therapists, parent educators, and other qualified professionals that make up our treatment team. Working together, we all could come to a good conclusion. And oftentimes, sometimes we will not agree initially. We will have to battle it out and struggle it out within each other to make sure that we come up with the exact outcome that is correct for the family. We do see the children with both parents. We think that one of the things that is most destructive within the court system is when a therapist or an amicus will only see the children with one parent. So we insist in our assessment that we will see the children with each parent. Now, we've had a number of cases where parent-child hasn't been together for years, sometimes 1 year. In one case, I believe it was 4 years. And so what we will do is we put together a Zoom session, which I will usually guide, and we will reintroduce the parent and the child, but we will also establish the foundations of courtesy and respect. And then that prepares them to see each other. And this meeting, while sometimes it can be awkward, is often really wonderful, even from children that say they do not want to see their parent. We ask both sets of parents to send us emails, audios, videos, and information to review. We interview professionals. We do all of our due diligence. We interview professionals such as therapists, psychiatrists, former amicus, current amicus, supervised visitation officers, and we check the facts. We literally look and see, are these parents telling us the truth about what is happening? We also interview collateral family members. We've talked all along the way here about the generational problems of alienation. And so we believe that grandparents are often a very good source, sometimes aunts and uncles that we will talk to, those that are part of both families. We will also review all reports. So the other piece of our really wonderful assessment program is that over the years, we have developed a number of data-driven diagnostics assessments, and we use established theories of attachment system and family systems that all work together and are peer-reviewed and published. And this makes, so when we do end up in front of the court, or when our assessment report ends up with the court, they can be assured that we have utilized not one source, but a number of sources, not one assessment, but a number of assessments. And then when we put them all together, we will often find it completes that puzzle. So first we examine underlying family systems regarding accepted theories We utilize John Bowlby, the father of attachment, Salvador Minuchin and his work in triangulation, the father of family systems, and Benjamin Garber, who has done a great deal of work in parent-child role corruption and enmeshment. We utilize the SCARF, the Structured Child Assessment of Relationships and Families. We utilize Rohner's Personality Assessment Questionnaire and the Parental Acceptance Rejection Questionnaire, which Bill Burnett has done a great deal of work and study on and research that shows it's very, very valid and effective. We also do something called gatekeeping analysis. This is William Austin's bench book. It's a really wonderful article that talks about restricted gatekeeping, unrestricted gatekeeping, how it works. And then last but not least, we do the 5-factor model of PA. It's actually the last thing we do. Why? Because we want to have so many other things lined up that by the time we get to the 5-factor model, things are usually pretty clear for us. And then there are times when we have employed other specific diagnostic tools. You saw Dr. Alan Blockey today, who's done a lot of work in false sexual abuse allegations, and we have been able to use his work in some cases. So sometimes we're not able to make assessments like that in terms of things like false sexual abuse allegations, but sometimes we can, depending upon the case and how it is given to us. So I'd just like to give you an example of the SCARF. It's the Structured Child Assessment of Relationships and Families. The valuable part about the SCARF is it is a nonverbal test. It is a nonverbal self-report. It's used with stamps that the children stamp, but we use it with kids from 4 up to the age of 18. And it has very high reliability and validity all the way through, but specifically for young children. So we have found it to be very, very helpful. And we'll just show you here, this is an example, something out of the SCARF book, the SCARF instruction book, which talks about the difference between amiable parents up at the top, where both parents have high emotional security and high positive parenting and low negative parenting, estranged parents, where you're going to have one parent that perhaps has alienating behaviors, but you have another parent that has significant problematic parenting practices that create estrangement, which is different than alienation. In this case, you can see that the favored parent has high emotional security and high positive parenting, low negative parenting, but the estranged parent has high negative parenting, mid-range negative parenting, some positive parenting, and some emotional security, as opposed to the alienated child who has high emotional security, but a high positive parenting and 0 or only 1 negative parenting, and the alienated parenting has no emotional security, little to no positive parenting, and very high negative parenting. So you can see there are significant differences in how we look at this. So in our complex family assessment and treatment program, our goal is to heal and restore the entire family. And a larger goal is to end the transgenerational transmission of trauma. So what has changed in the last 6 years since we have started our assessment process? So first, we continue to assess and, if agreed in order, treat any family where there are questions. We call it the complex family assessment and treatment program for a reason. We do not talk about alienation in the title because we don't know that that's what it is. And oftentimes we found that if we talked about it as the alienation program, in our early days it was called that, then people would decide it was not alienation and they did not want to use it. So we determined that when there are all these accusations going back and forth, it's better to keep an open mind, and that's why it's complex. So sometimes there are CPS issues, there are dynamics, there are accusations, or this is just a family that's called high conflict and the court does not know what to do. We have moved a number of families throughout our program, and we are often requested by parents and judges in multiple counties as well as out of state. We use multiple peer-reviewed and published assessments, and we've already talked about sessions with both children and both adults and children together on both sides. We find that the amicus, the ad litem, and the current therapist are often the most supportive of the work that we do. Oftentimes they can see there's a problem, they understand that there's something going on, but they do not know how to say it in a way that's going to be effective with the court system. We can recommend consequences about following through on treatment as recommended by, requested by judge or amicus. And you heard very briefly from Joan Cloth-Zenard, who is the author of 3 Strikes and You're Out. Early on in our process, we contacted Joni. She sent us a lot of amazing information, and we still have that information out today. And we have seen the 3 Strikes and You're Out program work very effectively within the court system when it is utilized. We can testify in court to assist a judge in ordering the assessment. That's what Wileen does. We can testify in court after providing the assessment results. That's usually what I end up doing. And we don't always have to do this, but we can. We have been able to ascertain false allegations in certain cases. Our assessments have been successful in creating faster change because what we have been told by the therapists that work with us, excuse me, after our program is done, or after our assessment is completed, is that because our assessment is thorough, they know exactly where to begin. They don't have to spend any time evaluating, and they can focus on treating. Generally, we make very specific recommendations related to specific named therapists, educators, and facilitators to avoid delay. Oftentimes, much of the problem in the court system is which person are we going to use? So we have worked hard to expand and consult with other therapists to determine who is qualified to help us and who can help us and who we know that if we recommend this family to, that they will keep in touch with us and we can make sure that everyone is clear about what's going on. We've also been very pleased, and this is something Renee and Wileen have been working on for a number of years. They have added a number of interns to our staff each year. We have social work interns from graduate schools, counseling work interns, and they are now training a new generation of therapists who understand. And this is really, really exciting. I will also say here that we have recently begun a low-cost counseling clinic by our interns overseen by fully licensed professionals. We have found that many families and children in the court system, due to all the money they have spent, often do not have a lot of money left over for counseling, and that perhaps we cannot, while they really cannot see families that are currently in court cases, they can work with families and children and adults to support them in the process of recovering. So the last piece I want to talk about here is connecting with and forming relationships with other mental health professionals. So what we want to say here is if you are a mental health professional, we would love to hear from you. We would love to connect with you, to work with you, because only consulting together, working together, can we strengthen the community's ability to work and to develop and to assess and to treat what is happening in our communities. And we want to make sure that we're all working together in that cause and not working against each other. So if you're interested in discussing our program as a parent, an amicus, an ad litem, an attorney, a mental health professional, or a judge, please contact Wileen Lindsay. And please wait until Monday morning. So I do sometimes have people contact me in my office, and I cannot work directly with you, especially if you're wanting to be assessed. So Wileen receives calls all day long, every day, and takes each one, personally handles it, gives it a lot of kindness and communication. And she'll be happy to answer any questions for you or how it would work. About the legal documents that we will need. We have some of those that we can provide to you, etc. But that is a bit about our program. I'd like to turn now briefly to talking about ways in which alienated parents can manage ongoing alienation or current alienation that's happening, either whether or not if they have contact with their children or if they do not. And this can be if they have children that are younger than 18. This can also be related to adult children. I do some work with parents and adult children as well as children and parents. So the 4 things that will keep your children from you, the first one is anger. So we talked a lot in the disordered mourning discussion this morning about the vital role, the important role, the significant role that anger plays in disordered mourning. And so the problem is that when your child's anger is kicked up by the targeted parent or the unfavored parent or the alienated parent, it creates a lot of problems. And so one of your goals is to lessen those opportunities where you are doing things that create anger in your child. And I'm not talking, if you have your children there, I'm not saying you should never discipline them. I'm not saying you should never tell them something they can't do, but I'm saying your anger can create problems for your child. So your job is to try to be as calm as possible. Your job is to try to be as emotionally regulated as possible and to figure out ways to do that. It's not easy, but it is really, really important. Another one is guilt. I can't remember which speaker it was. There have been so many wonderful speakers talking about, saying to your child, oh, I really love you. I miss you. And, the alienator does this to create guilt. When we as alienated parents do this, it also creates guilt. And in just a minute, I'm going to give you kind of some different language to use. But the goal is to perhaps not tell your child you miss them, but to tell them that you thought of them today, or you saw something that made you laugh. You can connect with your child without telling them that you miss them. And I'm going to say this, they already know that you miss them and they know that you love them. So try not to do that guilt, because Karen Woodall talks about underneath the alienated child, underneath the anger and all the things that you see, is a very large layer of guilt and shame from the way that they have treated their parents. And so we don't want to try to guilt that child, because that kicks up that shame and will actually push it back down. So we want to not guilt them, and we're going to talk in a minute about some ways to do that. Another one is feeling unheard and misunderstood. When your child feels misunderstood and heard from you, it makes them angry and it makes them upset, unheard and misunderstood. And then don't talk about the other parent is wrong. And I think this is probably the single hardest thing that targeted parents or the unfavored parent has to contend with. It's very, very difficult not to justify, not to argue, not to defend, not to explain. But I'm asking you not to do that. Instead, what we'd want you to do is show the child you can see what a difficult position they were in or they are in. So I'm going to stop right here and I'm going to, let's see if I can do it. I can't do it. All right. Okay, so when you're working with your child, Bill Eddy is the head of the High Conflict Institute. If you are not familiar with the High Conflict Institute, they have a wonderful program on high conflict co-parenting that's quite good, and some other resources for you. He talks about when we are working with a high conflict person, or in this case, someone who's having trouble hearing you. And in this case, this might be your child. Use ear. Ear stands for empathy, attention, and respect. And your goal is to utilize ear with your children. So when they get upset, when they get mad, when they act frustrated, you can utilize ear by saying things like, I know how hard you are working to be a good son to your dad and me, or to your mom and me. So this is something that tells a child that you understand the difficult position they're in. And sometimes you may not feel they're working very hard for you, but the point is to say it anyway, because I promise you, underneath the alienation piece and the suppressed attachment system is that layer of guilt and shame. And anything you can say to your child to let them know that you love them and that you understand is really, really helpful to them. I can see how upset you are about this. How can I help you here? So this is something else that you can easily say to your child. I hate it that you felt so stuck between your mom or your dad and me. And then I would also tell you that if you have a child that you're still seeing, and they're going in and out of your home, and oftentimes with each of your children, to talk to them, what would you like to do when you come to my house? Now, if they're in a stage where they don't want to talk about these things and they don't answer you, just say, well, why don't you think about it and let me know? But the idea here is to create some sort of structure with your children coming and going. When they come into your home, maybe they always have a favorite meal. Maybe you always go to the park. Maybe you sit and snuggle and watch a bit of a movie. Sometimes your children may come from the other parent's house and be very quiet and be very shut down, and they may need a little bit of time to warm up. And after 30 minutes or an hour or 2 hours, then you can all be together. But you can have these kinds of conversations. If they don't work, they don't work. But this is a good plan, and it's one that will usually work if you will address it. And then oversharing issues. So oftentimes I'm asked questions like, what do I say when my kid says, well, dad told me we have to go to court and you're causing the problem, or I want to know what's going on. And a basic answer is something like, I know it feels good that your mom or dad is sharing this court information with you. And I know that, and I want, I think you're very grown up too, because that is what the other parent is telling them. But it's kind of complicated. There's a lot of people involved. I'm happy to hear anything you have to say, but it's not really up to me. There's an amicus and an attorney and judges and a mediator. And I won't be able to do what it is you're asking me to do. And then once again, you are so thoughtful, kind, trying to so hard to be a good son or daughter to me. It's just very complicated. And then I just want to encourage you, if you still have contact with your children, or even if you don't, to rebuild your emotional bank account with them, to say positive things, to not create guilt, to not say anything about the parent, but to say things like, I've been thinking about how hard this has been for you. I can see that you may have felt really stuck. I hated that this has happened. Or even, I've been working on some things about myself and have realized you did not feel you had a choice, i.e., if you've had some harsh words with your child about testifying against you or talking to the judge, this is something that you could say. You notice here, I'm not telling you to fall on your sword or beg for their forgiveness, but what I am telling you to do is to utilize your own self-care and good emotional regulation and let your child know that you're not upset with them, you're not mad at them, and that you still love them and care for them. And this is one of the ways that you can do that. So taking care of yourself is the best way to reduce the guilt for your child. And I love what so many of the speakers today said about this. John Brownlee in particular talked about this. Stay in the present moment. When we get too far ahead or too far behind, our amygdala kicks in and all bets are off. I would encourage you to learn to process your triggers using EMDR, hypnotherapy. There are a number of wonderful things that can be helpful with that. And get support. You could not have too much support. There are a number of good resources. There's books, there's coaching, there's support. Dr. Amy Baker, Joshua Coleman, Ginger Gentile, Karen Woodall, Wendy Perry. There's a number of people out there that provide support for parents. And so even if you have a therapist, there are other ways that you can work and meet with alienated parents and with other folks that are struggling with what you are. I think somebody else mentioned the PASG, the AFCC. There are a number of places where you can get this support and care. It's Terry Real, the therapist and author, who says, family dysfunction rolls down from generation to generation like a fire in the woods, taking down everything in its path until one person in one generation has the courage to turn and face the flames. That person brings peace to their ancestors and spares the children that follow. And our belief today is that by you being here, that you have assisted us in bringing peace to the ancestors and sparing the children. And we thank you today for your courage to come and to face the flames with us.
So it's done. Yes, you're good.
Okay, so I'm happy to take just a couple of quick questions if anybody has any.
Yeah, I have a question. So when y'all do the assessments and then you have these mentions, then do them, does them
With us because we did the assessment. Sometimes, every now and then we might have a parent that would like for us to work with them. But as a general rule, what we do is we make recommendations for specific therapists, educators, facilitators that they will be using both individually and together. And then we can assist in overseeing that. So if the family would like for us to assist in overseeing that, as you know, oftentimes courts, judges, amicuses are really want to close a case. then the family works together with us and we will oversee the treatment. So basically we bring together all the people that are involved in the treatment with the family, and they have their own treatment team meeting every month with Dwylene. So we can oversee it that way.
So can y'all be in a court monitored position with
Yes.
doing the assessment? Okay.
Yes, right. So what happens is that because Children for Tomorrow is not a therapist, they are an agency. And as a result, there have been some cases where people have asked Children for Tomorrow to oversee the family and the treatment. And that is how that works. Does that make sense?
So sometimes you may not do the assessment, but they'll ask y'all to monitor.
No, we would not.
Or does it go hand in hand?
Yeah, it generally goes hand in hand. We've not been asked to be a monitor where we have not done an assessment. So normally we're asked to do that where we've done the assessment, but you'd have to talk to Dwylene about any of those other items you mentioned there.
Okay, thank you. Okay.
Yes, Chris?
Yes, in a situation where we already have a guardian ad litem report that's recommended turning points, and we've already went through CPS, police, court, and so forth. We've noticed that the kids have completely shut down of all professionals. If we were to ask the court to have it court ordered that you guys intervene and have some sort of what I would call a forensic evaluation in so many terms, could you just look at all the paperwork and everything that's been done so far and have minimal, if any, contact with the children because they're so entrenched in the situation now, and it's hard to get anything out of them at this point?
So I think
it's further abuse to continue to put them through this, because it's reliving the trauma over and over and over. And I'm trying to help them to not have to deal with professionals all the time.
Sure. So let me just say that first of all, we are not a forensic assessment as much as we are a trauma-informed therapeutic assessment. And part of what that means is that, when we're working with these children, in fact, what we started doing is they generally will come on a weekend, and we will spend all day with the kids. So we're hanging out, we're eating food, we're eating pizza at lunch and kind of having fun. And our family sessions are done on the floor with slime and goop and mad matter. So I will tell you truthfully, we try to make it seem as little like an assessment as possible when it comes to the children. Certainly in your case, if you've already had all of these things, it might make sense to do a modified assessment of some sort. But I would tell you that we would probably still want to see each of the parents with their, each of the children with their parents, or however that works. We would certainly could do a review or whatever. If you're just looking for is this the right, is this correct? We haven't been asked to do something like that, but I think we could certainly, Dwylene could certainly talk with you about the possibility of doing that. But we would want to see the children and parents together. But I absolutely understand what you're saying. I think almost every family we've seen, they are so sick of court. Some of our families have been in the court system for 10 years, 15 years. But I promise you, we get the interns in there. Not everybody's old like us, and got some young people in there. And we actually turn out to have, quite a bit of fun, I think. I think the kids are relieved, and there's this period of time where there are no parents around, and we really get a chance to get to know them. So we are trauma informed in our therapeutic assessment, and this is where I think it really helps. So
a follow-up question to that is, what state are you in? And I know that you do it in several different states, but how would you handle if it was in Washington state, for example?
Well, I mean, I think that generally speaking, our assessment could be done anywhere. I think the problem is, as a licensed therapist, we have to be careful how we go across state lines. But I will also tell you, we are not doing therapy. It is an assessment. So we have been able to work with families across state lines because we are not providing therapy as part of the process. But what I will also tell you is, when we are talking to the children, if we're having to talk over Zoom, we have the children go to the amicus office or the ad litem office. We do not talk with children in any parent's home. So we do some things like that to kind of protect it. But we'd have to talk with maybe perhaps your attorney about it, or the attorneys about it. We'd have to talk with the amicus. We'd have to make sure that we were doing it properly and in the right way, to make sure that it happens in a way that's appropriate for the
Thank you very
state.
much.
You bet. So, do you want me to look at the chat, Stephanie, or you want to do it, or we want to finish up here?
You can look at the chat. The most recent question was they wanted to know if we were licensed mental health professionals in New Jersey, and have we ever been involved in a New Jersey case?
Right. So we've not been involved in a New Jersey case. I can answer that one. And second of all, this is not therapy. So this is an assessment. And as a result, we can assess in any state. But I would also tell you that we would not be assessing online. So the family would have to travel to Texas to see us, or pay for us to go to New Jersey, one or the other.
We have probably time for 2, maybe 3 more questions. If anyone else has a question, just raise your hand or speak up.
Everybody may be a little
I have a
tired.
question.
Go
Yes.
for it.
When have you ever had to deal with any kind of admissibility issues with respect to any of your assessments that somehow wind up in a court case where they're challenging any of the assessment methodologies that you use, or in particular any of the tests that you use?
So I really appreciate that. It's nice to see you, Sean. So here's the thing. In our early days, we did not have a lot of assessments. We had a couple of assessments. Unfortunately, they were not peer reviewed or published. And so the very first case that we had, I had to testify in court. And so the validity of those things were challenged. And so after that, we began to explore what are the best assessments for us to use, and how else can we talk about this alienation, pathogenic parenting, gatekeeping. And this is when we decided to first we added the SCARF, then we added the PAC and the PARC. And all of these assessments have been around for 20 plus years, and all have good reliability and validity. So no, those have not been challenged. And then the gatekeeping has not been challenged, nor has the Factor V model. But I also think that because we utilize a number of assessments and a number of ways of looking at it, not always around alienation, but using other words, that it makes it harder, right? Because they can't, even if they don't like alienation, they can't say, well, this isn't it, because we have all of these other things. And, beautifully, it usually can line up like that. Or sometimes we'll have kids that come in and they say, oh, I hate my parent, it's awful. But then when they have to do the SCARF, or when they're doing a self-report, that's not what shows up. And so it's when a parent is not there to coach them, it's really hard for kids to kind of stay the course. And the ones that do are severely alienated, and the ones that don't, we can see a crack in the facade of the inauthentic child. Does that help, Sean? I think you got it.
Yeah. Yes, I was muted. Sorry about that. Yeah, that's fantastic. I wish we could clone you all and sprinkle you throughout the United States. It's fantastic.
Well, Dwylene and Renee are really the flag bearers of this. It was their brainchild, their idea, and they have done all of the hard work. So, like I said, myself, Shelley, the interns, we are all just lucky enough to kind of be in the process. So, anybody else have a question before we go?